So when governments are making decisions, they need to think about the health impacts of all of the policies that they have. And that means they have to engage in this space, that we need to be talking about health impacts of climate change. Get in there at the early stages before things cause a problem. So the sooner we act, the better. If we try and act in an integrated, working together, collaborative way, trying to make sure that we are thinking about the health impacts in all policies that we have, I think we have some potential good future. And there are lots of potential benefits from tackling these issues.
You're very welcome to the state we're in. Climate change has dominated the news headlines this week, with the COP26 summit in Glasgow and the government publishing its climate action plan on Thursday. I published a book back in 2008 on climate change, and one of the issues that I examined was the effects of climate change on public health. And to the best of my knowledge, there has been no mention this week of the long-term effects on public health of climate change. Today, I'm honoured to have the President of the Irish Medical Organisation, Dr. 𝐈𝐧𝐚 𝐊𝐞𝐥𝐥𝐲, talk to me about this issue. Dr. Kelly, you're very welcome.
Thank you very much, Anna.
Do you mind if I call you 𝐈𝐧𝐚?
Please do, Anna.
Well, 𝐈𝐧𝐚, as I said, there is no mention whatsoever about the effects of climate change on public health. So maybe you might begin by telling us a little bit about yourself.
Okay. Well, I suppose I qualified in medicine in Ireland in 1986 in Galway, and I would have trained in general practice because that's actually what my family, my ancestors were doctors as well, and most general practitioners. But as I went along, I got very interested in public health medicine, which is, I suppose, really a lot about trying to prevent ill health if you can. And so I trained, did higher specialist training in that, and so started working as a specialist in public health medicine over the last decade or so. And through that then I was very involved in environment and health work, which I've always been interested in, but it's actually part of my actual work now. And at the Department of Health, we're looking for public health involvement in climate change adaptation work over the last 8 years or so, and I've been person probably from the HSE doing most work on that. So I have really got involved in climate change work, both trying to prevent climate change, which we call mitigation, and then how we live with climate change. Obviously, we want to keep it as small, as least problematic as possible, but there are changes already occurring in our environment. So that's what we call adaptation. And I'm involved in that work as well with the Department of Health. So we are involved, and we are doing work in this area, but it is quite invisible in some ways. And as you mentioned, that health impacts haven't really been mentioned much. And yet they're probably the most important reason why we are actually doing something about this. Because much, I think, as we like biodiversity, we as humans think about ourselves as well, and it's the health impacts of climate change that are probably going to be most devastating to us.
So 𝐈𝐧𝐚, perhaps you might outline to us some of the more significant impacts on health that we're going to feel as a result of climate change.
Well, thinking about Ireland first, I suppose Ireland is a country that's very protected in certain respects because we're in a temperate climate, and we're protected from an awful lot of the worst effects of climate change so far. So we haven't really experienced very definite impacts. But what we would find with climate changing of climate, the changing climate, the effects it has, we expect in Ireland more and more extreme weather events like storms and so on, and then rising sea level and changes in precipitation, rainfall really, and then we're going to get more rainfall, and then warmer weather. We will have more warmer weather with heat waves, and those particular changes that the Met Éireann believe are going to happen, then they cause environmental effects, and then those environmental effects have health impacts. So there's a sort of a pathway really from the climate event to the health event. And that's becoming more and more clear that we're having those now, because I know that our meteorological organization, Met Éireann, are we're talking about the warmest years on record or recently. And everything is sort of, the extremes are starting to become more common. And therefore, we're already seeing these effects. I think we see that, with flooding and so on, we're seeing loss of land, and we see that people, the mental health effects are one of the big things from flooding, because people lose land, their businesses are destroyed, they can't get insurance, and that's a huge losses in their lives. They actually are, there's traumatic events for them in many ways, and that becomes a huge mental health issue that isn't necessarily even being measured at the moment, or being acknowledged sufficiently. And so people just bear their losses, you know, quietly in a way, and we've got to do much more to help them with that and prevent it as much as we can first, and then we would have in waterborne disease in Ireland. We already have a problem. We have very large numbers of people on untreated private wells in Ireland, which puts us very vulnerable to infectious diseases from the environment, which are really like in from we call them zoonotic diseases. They come from animals like cows and so on, and they're in their feces, and they come through the soil into the water, and then people drink the water, and if that's not treated water, then they're more at risk of getting pathogenic diseases. What we mean by pathogenic, they cause illness. And we have the highest rates of 𝐜𝐴𝐺𝐻 �E. coli in Europe, in Ireland. And I think it's possibly partly to do with that we have we're exposed to a lot of uh, untreated water, which is coming from an environment that is, affected by the I suppose, species of animals, really, and to be honest about it, and and I think it's something that goes without much notice as well. I mean, but we do have children in intensive care every year with hemolytic uremic syndrome, which is a complication of this 𝐕𝑟𝑜toxigenic E. coli. So it's very serious impact on health, not necessarily only to do with climate change, but it's more likely, we call that a vulnerability to climate change, because when you've got more flooding, then you're going to get more um, I suppose, breaching of the well infrastructure, and where it's flooding causes more runoff to run into wells, and if they're not being treated properly, then they're more likely to become contaminated. Um, that's one of the big impacts potentially in Ireland, and we're probably already seeing some of that as well. Heat is a huge stressor as well, and even in Ireland we haven't really seen a huge change yet, but I can see that we've had multiple heat waves over the last few years, and it causes all sorts of different types of problems. We had a short heat wave this year in which there were people, during the time when people were queuing up to get tested for COVID, but they're all and going to get vaccinated as well, and they were in queues outside, and there were people who were under stress and heat stress and fainting because of the heat. And we're lucky in Ireland; we don't really see that very much, but in 2003, there were 70,000 people who were estimated to have died from heat stress during the summer 2003 summer, mainly France and across, and that sort of part of Europe. Um, and it's something that is likely to come farther north as time goes on, that we're going to get more and more um, mortality from heat. And so it's something that we need to be careful of as well, because as we build our houses to become warmer in winter, we need to make sure that they can stay cool in summer too. And these are some of the challenges for us.
You mentioned there about water contamination, and I know this is not directly related to climate change, but the EPA published a report this week on water quality, which noted that there is untreated sewage from 34 different towns in Ireland currently entering our waterways, which is rather frightening. I suppose one of the issues that really concerns me relating to public health and climate change is the government's response to climate change. and particularly the imposition of carbon taxes, which is having a disproportionate effect on poorer people. I can see it myself. A bale of briquettes was €4 last year. Now in some of the shops, I noticed that they have almost doubled in price to about €7.50. For somebody on a very low income, this is very, very significant. Do you think that, particularly in relation to carbon taxes, there's a danger that people may suffer adverse health issues because of the cold over winter?
Yeah, no, that's always a big worry that we have inequity in our society anyway, unfortunately, that some people need more help at all times, really, and that doesn't necessarily happen. And when people, with poverty in society, people don't have the same opportunity to overcome the challenges that are arising in the environment or whatever. And that's, I suppose, these are some of our big societal challenges to try and address these things, because we need to have a just transition, and we need to make sure that really the people who need things most are actually probably to the top of the list for caring for making sure that they are looked after properly. I mean, when we're talking about, I suppose, fossil fuels like peat, from our perspective in public health, these have huge air quality problems too. So there's a huge benefit in dealing with this, like changing the type of heat systems we have. But there's going to need to be huge investment, and probably it does need to be investing in people, especially people who can't afford their own fuel anyway, or struggle with their own fuel bills, that they are at the top of the list when the investment in more sustainable heating is rolled out in the country. And these are huge challenges for our society, but we're going to have to prioritise the people who need it most. And we're talking about elderly and poor people and people who can't afford to make the adaptations and changes that are required to themselves. But there's a huge benefit, though, in changing this, because air quality in Ireland would be considered to be pretty good, and yet the estimation is that we have over 1,000 avoidable deaths from air pollution every year in Ireland. And so it is really worthwhile, and the type of reason why that would be to do with transport and residential heating. And I know, living in the Midlands, we see plenty of chimneys puffing out. I suppose what I was always used to, turf fires and so on, all my life I was used to it, and I thought it was normal. And now that I realize it's air pollution, I feel much more breathless passing through when a waft of smoke from somebody else's house comes down when you're going for a walk or so. So I think it's we need to become very aware of that. So this is where I suppose the changes have to look for co-benefits. And this is one of the things we need to do. And I think this is going to be something that I'll be talking about integrated planning. We need to look at, if you do one job at a time in a siloed way, you get adverse consequences somewhere else. And you're not thinking about, how is this going to impact on a person? How is this going to impact on a person? There's just too many impacts. But you need to plan everything together, and you need to say, how are we going to look after our poorest? How do we make sure that they have sustainable, affordable, comfortable houses? How do we, I know there are people who are homeless, so not everybody even has a house, but in a way we've got to think about that too. How do we look after our absolutely most needy people, people who don't even have a home? But all of this, we need to think about, all of the planning around this needs to be integrated with each other. When it's done in silos, you actually end up often with adverse consequences. What you're talking about there is you end up with heat-related potentially mortality, or sorry, cold-related mortality, or cold-related illness and so on, because we haven't had an integrated transition to a lower carbon future, which we've got to have. But we can get huge benefits as well from cleaning up our act in a way by um, reducing air pollution at the same time as getting more sustainable heating. But that requires a lot of planning, and it requires an awful lot of thinking about all the issues, as you mentioned there. We need to have everything on the table almost in the planning process, so that you actually start adjusting and saying, okay, we need more of this here, less here, that type of thing. And I don't think we do our planning that way yet. We're inclined to do it, in Ireland and in most countries. This is an issue that's affecting everybody. Budgets are down lines like a department of this or a department of that, and they think only about their own department. and they don't think about how their policies impact on somebody else in a different area. And that's where public health works. We work a lot in this space, really. It's trying to bring the health impacts of the Department of Agriculture's policy to their attention, and to the Department of Transport to their attention, and so on. And trying to say, look, if you try to work with us on this, and we all work with each other, that we can start finding co-benefits and getting more more benefits than just for one thing out of the same action. But you also need to be looking at the side effects as well, and make sure you minimize the side effects. And that's a huge, complicated piece, Anna, but it's the only way we're going to do it, and we need to do it equitably. And equity, I think, is about matching people's needs, not just giving everybody the same. Because everybody, when people aren't in the same place at the beginning, you don't just give them the same; you give them what they need, and that's we need to do it that way.
Okay, so there's a lot to unpack there in what you have said. I'm actually very much taken aback by the fact that 1,000 people a year approximately die as a result of the adverse effects of poor air quality. But as you say, that if we address that issue, we will automatically then be addressing the issue of tackling our carbon emissions. And I suppose what you're calling for there is that, all of the stakeholders come together and coordinate our action on climate change rather than doing it piecemeal. And I suppose the danger is that politicians are elected at most for approximately 4 years. So they're very short-sighted in their vision. They're only interested in the next election, and they don't actually see beyond that. Well, Ina, it has been a huge honour, as I say, having you. Before you go, I just like to put one final question to you. If you had a wish list, what would it be?
Well, I suppose, Anna, I think there are a few things that I'd like, really, but I think we do need to have empathy for each other. That's definite, and I think that's working together is essential. And I suppose we need to be thinking about the people outside of this country too, because I really only talked about what happens, and we're so lucky that we're not going to get the worst of it, at least within the foreseeable future. But there are people in many countries are going to have a much worse versions of what I've mentioned, and a lot more other, more emergencies and more disasters and so on. So I think we need to have empathy for our global brothers and sisters as well. So we need to do our best to try and transition to make sure that we are not using up more resources than our fair share in a way, which I think we do a lot more of at the moment, because we're very lucky we've been born into well-off societies, and we've got used to comforts that, and maybe, things like that. So I think empathy is one thing, and I think a lot of us have it, and that we just need to make sure we're using it all of the time. Another thing, the World Health Organization asks us to do health in all policies. So what you were mentioning, health is a big impact of climate change, but it's not necessarily being thought about. So when governments are making decisions, they need to think about the health impacts of all of the policies that they have, and that means they have to engage in this space. That we need to be talking about health impacts of climate change, and looking through it and seeing how is this going to happen. And maybe, as you said there, with the expensive fuel, there's another health impact of a carbon tax if we don't mitigate that somewhere else. And I suppose, and I think that upstream, public health often thinks about doing things upstream. Get in there at the early stages before things cause a problem. So the sooner we act, the better. If we try and act in an integrated, working together, collaborative way, trying to make sure that we are thinking about the health impacts in all policies that we have, I think we have some potential good future. And there are lots of potential benefits from tackling these issues, apart from keeping the global temperature, the warming to a certain limit, hopefully 1.5 is the max or whatever. But if we can work together on that, I think we can improve our equity. There are an awful lot of benefits, because with integrated planning, as I mentioned, we can actually think about our poorest most, because we have to think about them. We're often as weak as our weakest links in a way, so we have to try and think about the broader picture more, which is very good. So I think if we think about the benefits and the co-benefits of different strategies, I think we'll feel happier about the things we have to tackle as well, Anna. So I hope that covers some of what you
Yes,
wanted to hear about.
it most certainly does. Dr. Ina Kelly, President of the Irish Medical Organisation, thank you so much for taking the time out from your busy schedule to chat to me today. To those of you who are viewing, 𝐸 Media is a new news platform that has been established by myself and Dr. Finbar Markey. We'll never ask you for money, but we do ask you to please share this video and get it out to a wider audience. And please subscribe to our Facebook page and our YouTube channel. And we're also available on mcompassmedia.com. Thank you so much for watching, and until we meet again, Bannocht Day or 𝐈𝐧𝐚 𝐊𝐿𝐴.